My name is Johanna Ralston, and I'm Chief Executive Officer of the World Heart Federation. The World Heart Federation is unique in that it is the only global cardiovascular disease and cardiovascular health organization. We work in official relations with the World Health Organization, and we represent the entire cardiovascular health community worldwide. The partners of the World Heart Federation include the World Health Organization. It includes our largest members, cardiac societies and heart foundations from all over the world. It includes tobacco control organizations, groups engaged in nutrition, physical activity, access to medicines from across the globe, both in low, middle, and high income countries.
Firstly, I think we undertook a very clear prioritization exercise and identified high blood pressure control, tobacco control, as well as secondary prevention of cardiovascular disease as the major areas which will have an immediate and strong impact on reducing the burden of cardiovascular disease in the world. We also ensured that these were clearly aligned to the World Health Organization's goals and targets for reducing premature mortality of 25 by 25, which is reducing the mortality in the age group of 30 to 70 by 25% by year 2025. The battle has just begun. I think we have had some success in ensuring that some goals have been set at the global level through the United Nations and the WHO process. But the key challenge now is going to be to see that these targets are attained, and that requires concerted action at the policy level, at the level of professional associations, at the level of communities, and at the level of health systems.
The second key approach is to generate information that's relevant to low and middle income countries. Equally, the barriers to implementing what we already know works is different in different settings. In the poor countries, in addition to this, is the fact they're simply not affordable. So we must come up with customized approaches to dealing with prevention depending on culture and economic setting. We need new models of care when non-physician health workers working in teams with physicians deliver it. This will increase the reach of what we tend to do 10 to 100-fold and decrease the cost of what we do substantially. The last thing is cardiovascular disease is, as I said, an epidemic. You can't manage this or avoid it one person at a time. You need a strategy that is akin to the control of epidemics.
We need to work together to ensure that the Global Action Plan for Prevention of Non-Communicable Diseases is translated into national action plans, which are then implemented. We have an Emerging Leaders Programme, and this is a very important platform in the new World Heart Federation structure, and we are bringing together people in the early stages of their training, and not just in cardiology but in medicine, in nursing, in allied professionals, in order to engage them in international actions which will lead to prevention of cardiovascular disease in their own professions and in their own countries. So we are stimulating the development of leadership which will result in actions for prevention in their own profession and in their own country.
The World Congress of Cardiology and Cardiovascular Health, which will take place in Mexico City in June 2016, will build on the tremendous success that we had at the World Congress in Melbourne in 2014.
A board alone, a man alone, a member alone can never do that. We need a lot of friends. And most of those friends starts with P, patients, professionals, press, politics. If all those stakeholders join us in the 25 by 25 battle, then we will be successful. There's no other way.